in news closer to home now, a new study has found that a substantial number of people were able to buy alcohol illegally during the lockdown alcohol bans. The study also found that heavy drinkers drank even more during those bans. Well, for more on this study and to find out exactly what the science says, I'm joined virtually from Cape Town by Marika Theron. She is a lecturer at the University of the Western Cape and a study co-author on this specific field of expertise. Marika, thank you so much for your time this evening. A very interesting subject matter because, of course, this was headline news throughout the pandemic as we had these alcohol bans that came and went as our COVID numbers went up and down. So I'm sure you found this study very interesting and couldn't wait to get your teeth sunk into it. Just very quickly, before we get into the findings, you conducted a survey on Facebook from July to November. Of what year was that? And how did you find doing this research via Facebook? Is this these kind of findings through a Facebook survey dependable in your field of science?
Thank you so much, Marcel, for having me on your show. Yes, so this research was very interesting, and just to see everything unfold as we were gathering the data was really amazing. So, number one, it was done in 2020, so it was definitely during those alcohol sales restrictions. And so we could actually ask people how this affected them, you know, when the alcohol sales restrictions were happening. And, you know, were they consuming more alcohol or less alcohol, and what was their reasoning for this? Secondly, we used the Facebook survey because it was an easy way to do it at the time, because we couldn't move around. We couldn't really do anything other than online because we were in such a hard lockdown situation. Unfortunately, Facebook isn't the best way to go about getting our entire country to give us their input, because it is an online, internet-based. And, you know, you must be someone that wants to be on Facebook and you want to take part in that type of a survey.
Okay, very, very interesting.
So it's not necessarily the best way to do it.
One can understand, and it comes with restrictions, and at that time, even more restrictions, which is what a lot of the study was about. Did COVID-19 related regulations, I'm paraphrasing here now, reduce alcohol intake during this battle with the pandemic? Now, you focused on what you call heavy episodic drinkers and your more moderate drinkers. Can you give us a quick definition of those two types of drinkers?
Yes, so this might open some people's eyes a little bit, but did you know that if you as a male consume 6 alcoholic beverages in one occasion, like at a party, and you do that more than once a month, then you are classified as a heavy episodic drinker. And for females, that's even less. So if you drink 4 standard alcoholic drinks at one occasion, you will be classified as a heavy episodic drinker, which is, you know, for many people, and for myself, when I started researching in alcohol, it was quite an eye-opener, because we find that alcohol intake has been kind of normalized in our society at this stage, and with our country's history with alcohol.
Now, according to your study, it was interesting in that the regulations being tightened and relaxed had an impact on those taking part in the survey on their approach to alcohol. So if I'm reading this correctly, when the restrictions were tightened and alcohol was banned, there was more stress and anxiety, and therefore people really, really wanted to get their hands on the alcohol. Explain to me what your findings were in that regard.
So we found that definitely, to answer the question of whether people's intake of alcohol reduced during the alcohol sales ban, yes, it definitely did reduce the alcohol intake of the majority of people. And what we then saw is that, unfortunately, people who were very stressed were consuming more alcohol. And with the heavy episodic drinkers, we found that they, instead of consuming less, were consuming more. Whereas with moderate alcohol consumers, they actually did consume less or try to actually use the opportunities to completely stop drinking alcohol. And then we found that those people who were drinking heavily were more prone to buy alcohol illegally during the alcohol sales bans. And in total, for everybody, we found that 50% of people were reporting to buy alcohol illegally.
There was an uproar every time the alcohol ban was brought up, and there was talk of the fact that South Africa needs to have an honest conversation with itself and ask the question whether we as a country have an alcohol problem. Do you think that the study points you in any direction in answering that question?
Definitely. We can definitely see that the amount of people saying that, they drink those amounts that make them heavy episodic drinkers are, 50% of the people that responded in this survey were actually classified as heavy episodic drinkers, which is in a sample size of, let's say, 800 or so. It's quite a big number. And so we do have an issue in South Africa with alcohol intake. And we can just look at the fact that alcohol sales were banned due to the fact that our hospitals were full of people that were in accidents or being, attacked or while they were consuming alcohol. So there wasn't enough space for people to be in a hospital because we were filling it up with people who were attacking each other due to their alcohol intake.
According to your study, would you... sorry, Marika. According to your study, would the recommendation be that these kinds of restrictions would indeed be effective in reducing alcohol, or is it the other way around?
Well, definitely the restrictions did reduce our alcohol intake. However, we see that we can't say that one size fits all. And depending on your situation, if you are a heavy episodic drinker and you're in this stressful situation, you will be consuming more alcohol. But the World Health Organization is saying what we should be doing is, with our increased prices of alcohol, we will see a reduction in alcohol intake. But also what we need to do is help support people financially during extreme emergencies like this. And not only in South Africa during an emergency, but in our day-to-day lives, because people need to know that they can have food. Food security is such an important part. We cannot live without food. So I really support the idea of a basic income grant, and I really think that if we do that, we can reduce the stress and anxiety of the people of South Africa, which will in turn hopefully reduce the alcohol intake.
Okay, we're going to leave it there. Thank you so much for your insight. That is Marika Tron. She is a lecturer at the University of the Western Cape and a co-author on that study that focused on how South Africans took their tipple or took their alcohol during the pandemic and whether those restrictions helped or not. I didn't partake at all throughout the pandemic because I was busy bringing a human into the world, so that did help, I suppose. Still